So,
Is this meeting important?
I'm going to be talking about things that are very macro, very large level. To just kind of get us oriented.
It's very hard to hear.
That's what I was afraid of. Let me sit over by that. Let me sit over by
You
that.
go right ahead.
Donna, I'm going to get closer to the laptop.
That's much better, much better,
Okay.
much better. Thank you.
All right. So the macro view of the budget. First things first, the human services budget is governed by chapter 46.26 of Wisconsin statutes. So you can find actually what your process is as a human services board in the budget under those statutes. It's the board's budget. So at this stage, the human services board actually creates a budget for the county executive. It goes to the county executive, and then it becomes the county executive's budget. And then the county executive presents that budget to the county board. But you, by statute, create the first budget. What we do for you as an admin group is that we create, basically fill in the budget with kind of the directive of the county executive. And then we kind of go with that target first, and then you can listen during the public hearings to people's comments about whether they like the budget, whether they like the programs, whether they don't like the budget, they don't like the programs. And then you all can deliberate with us on the 29th and then decide to keep it as we have prepared it or to add to it or subtract from it. So that's the first step. The budget is built around what we expect to spend in terms of employee costs, overhead, and provider costs. Those are our three big groups. So personnel represent about a third of the budget. Another third is basically our fixed costs, overhead, operations inside the department. And about another third, maybe even a little bit more, are actually costs that we give to providers to do services for us. Because our employees alone don't do all the services that you see in our annual report. They're done partly by our staff, but also partly in combination with our private partners. So we build a budget around what we think we need to have in the accounts in order to pay our expenses and what we think we're going to get for revenues from the year before. Okay. We have about 20 plus years of budget actuals that help guide us when we come up with revenue targets and expense targets. So we're not shooting in the dark. It isn't a basic, guesstimate going on 1 year. It's 20 years worth of actions. This year's target for all departments, and this is new, for all departments in the county executive has asked for a 0% increase. So not just one department. We have had that responsibility in multiple years of having a 0%, but all departments are coming up with a 0% budget. That's what the county exec would like us to shoot for. Yeah.
Does that include personnel increases or?
In every case, it's going to include that that's another point I'm going to make. Let me just answer it this way. We have to calculate an average of a 4% merit raise, and that's an average for county employees. Increases in operational expenses and provider costs, which we're going to estimate at around 5% on average. So all of those new expenses have to be included in the 0% levy target.
Okay, not being having math as my forte, being the largest department and having the most employees who get the most raises, merit, does that mean that our percentage of decrease to reach that 0% is going to be greater than anybody else's?
Percentage-wise, it won't be greater. Dollar-wise, it's going to be a lot more. I mean, dollar-wise, it's going to be 1.5 million that we have to come up with either extra revenue or decrease expenses. But it represents about 3%, which is about the same that other departments have to come up with somewhere between 1.5% to 3%.
And what cut did we take last year? What kind of how did you cut the budget last year?
We did 0% first, and then we went down another
1.8.
1.8, and then we added back about 800,000 or so for connect new So we still went down, yeah, we went, well, yeah, our tax levy went down last year. Yeah. So 0%, but all the departments are doing it, so we're not being targeted as a sole department to do that. And as you'll see, when we get to the budget, we have already gone through the exercise of reducing the budget by 1.5 million. They're a combination, and I don't want to go into all the details today, but it's a combination of reductions in some personnel, reductions in some provider grants, and some provider reductions, and then also some drops in expenses internal. Let's try to get there. So it's nothing new. This is my 30th year as an administrator son in the county system. Every one of those 30 years, I've been asked to get to 0 or close to 0. So this is not like a brand new exercise. This is something we've done like year after year.
So he's not asking you to do anything different than you did last year. 0, try to get to 0.
Actually, if it remains 0, it's going to be less than what's required.
Oh, so you did 0 on your own.
We did 0 on our own last year before the other requests. Yeah. It's 0.
And cutting personnel, does that mean also cut to program?
Yes, in some small ways, yes, and we'll tell you what that affects. Yeah. And the personnel that are going to be involved, none of them will be laid off as a result of this year. But I mean, for this coming year, but that could happen in future years. So then let's see, we have we're going to go through this stuff. We'll go through the cuts in detail and let you know about that on the 29th. So for everybody's, it's important to note that typically we would do a budget hearing on a Wednesday night in Neenah, and then a budget hearing in the morning of Thursday the 30th, and then go right into our budget stuff. But because we are going to try to be here, Larry made the decision that we're going to do both public hearings and the budget here on the 29th. So just one day here. Yeah.
I'm thinking about comparisons from last year to this year in the budget process.
Mm-hmm. That's in the figures.
Yes, okay, does the budget, you said we'll get it ahead of time.
Mm-hmm.
Is there some sort of executive summary or narrative provided with the book of numbers?
Yes, of the cuts of the, kind of big picture where we made big changes, there's going to be a page that's just on that.
Okay.
You'll see that. And then with each one, there's like 2021 actual, 2022 budgeted and approved, and we're not going to have all. We're going to have all of 2022 actuals, so we can show you that. But we won't have all of 2021 actual and budget for 2022. But we can't tell you exactly how it's going to be this year. That's the way we try to do the financials. So you'll see some comparison, and then you'll see what we budgeted for 2021 and what we're budgeting for 2022. And if it changes, there's going to be a percent column of how it changed, like how much of a percent it changed. So it can kind of clue you into, oh, this one changed a lot. Maybe we should dig into that and figure that out.
If you want to see what the budget book looks like, there's one on there.
Yeah, and I tried to show everybody during the orientation. But you don't have a chance to necessarily go through it. Usually people come with a few questions. I think every board member here comes with a few questions on different areas, and each person will go through their division over a course of 45 minutes, an hour. And then we go through it and then answer your questions as we go.
So you'll bring what you guys have talked on and come up with your plan, and then we look at it to see if it makes sense. And then the executive get it, and then he looks at it again before it goes to the.
Yeah, so once you guys finalize it and approve it to send on to him, then he will take most of the summer. He factors in everything that's going on in the whole county And then he will potentially meet with us the end of August. He will meet with us the end of August. And then he'll recommend maybe some further changes to it that he basically can do on his own. It doesn't get brought back to you to approve his changes. It's just his changes.
We won't get it back.
We won't get it
Every
back.
time we have to move on to
Right.
do it, otherwise it's
So this is your, basically, this is your recommendation to the county exec.
You'll have that budget book, like it's right there, you'll have that budget book for a couple of weeks to go over and look, you don't just look at the day we start discussing, you want to study that.
right. I know what you said, but I know I've heard many times that people get the books and they come to the meeting not prepared and have the book and ask questions, but really have looked at. I mean, that's what I heard.
I'm sure that happens.
So and it's a lot of people. So I just want to make sure I'm prepared too to do that. Everybody says, make sure you read it, but then I hear, oh, we got.
I think what Becky had just asked a moment ago
I do.
about the big changes, we're gonna identify the big changes in the budget, so that maybe something you really wanna focus in on. And then if you want to drill down more, you can also call me up ahead of time or Janet ahead of time and ask us specifically about, hey, I don't understand this. Would you explain that to me? Or more than welcome to try to answer your question.
And who that had also makes the budgetary meeting not last so long if you've got your answers. If you think it's more than everything else right now, probably Bill and Sharon, a lot of people say, we've already discussed this. But waiting until the meeting, you want to get the meeting going on, so try to go through everything and ask your questions beforehand if possible.
Right, and like Bill said, then we put our suggestions in, we kind of take a vote on the package that we want to send to the county exec. And then, like Bill said, he looks at it all summer long, and then he sets up budget meetings with department heads, and we, Bill, myself, and Renee, and Janet probably, and then we meet with the county exec and we go over whatever changes he wants and doesn't want changes or changes that we see in there. So, yeah, so we meet, so you guys don't, but we meet with the county exec one more time on the budget after you guys finalize.
And then the end of October, for you have a plan coming forward,
Yeah.
you're gonna spend about 3 days of time going over everybody's
You guys
budget
go over
on the county board. So you get to do it again.
Now, Carol, you joined us last year. Do you want to share anything with your group about when we met with the exec? From your perspective about how that went, so people can get an understanding of what goes on when we meet with him?
Well, yeah, the county, we meet, like I said, we meet with the county executive and he'll ask questions of why you have an increase here or why you have a decrease there, have you considered this or that? And it's all communications and he has the authority to change whatever he wants. And you got to kind of respond to Ralph's earlier question that Ralph, in October, when you go to county board, you're gonna have a chance to, if the executive took something out of our proposal, out of our number, you do have a chance on the county board floor to put it back. Or whatever. There's a lot of give and take in the whole process, and it is a long process, but it's democracy in action. And everybody gets a chance to say what they want.
I'm just concerned in the months that we've been doing this, I've been on this board and helping. There's a lot of concerns that came out. And in the past, some of them kind of got dusted or couldn't go over and do research or do this, that, but I want to make sure some of those concerns are still in there, even though they want to cut it. You know, we have a responsibility to our employees, the people working here, that we don't want to forget some of that stuff. And I hear that it's next time. I'm not hearing it next time. I'm going to be honest with you.
But really, I'd like to make another comment.
You go ahead.
I made this many times, I'm gonna say it again, and trying to respond to Kara. You gotta remember, we're one department within the whole county. And the man responsible for the whole county is the executive. So, and in the state, like I said many times, the state of Wisconsin determines the total amount of money that we can tax. And they have a formula they put together. So when the executive says, everybody, the department's gotta come in with a zero increase, you gotta remember, he has to look at the whole county. He has the total amount of money available to him. And so sometimes he has to move some shelves around. And ain't that he's anti any particular department, it's just, it's part of his job. Okay.
I never respond to me because I think anti anything.
No, but you were concerned about if some departments were gonna get equally zero requirement.
Hello? Just a minute.
We had the biggest department, the most employees would be the biggest increase in salary. Was that, and then, it's like, it still turns out percentage wise to be zero,
Well, let me try it one more time, Karen, maybe you'll key on this now.
maybe.
It's, yeah. If put yourself in the shoes of a county executive. And he has to look at the whole county, all the departments are providing services, they all need money. Now, if our department here has got the second biggest budget, the sheriff usually has got the biggest budget. So you got the sheriff's department, you got the human services department, that's where the big bucks are. So if some other department needs money, he's gonna have to take the money from us or the sheriff. That's only common sense. I won't say anymore. So,
Okay, okay.
Good.
All right, so also I just want to remind you that community members, providers and users of our services are likely to be here on the 29th. So we will start in the morning by listening to them. They can talk about two things. They can generally talk about how the services are that they receive or how they're providing those services. They can thank us for, past years of providing some money to them. Or they can also come and ask for more money for the particular service that they're going to want to have or see have. So, I mean, it's both about telling us about how they think about the services and the budget. And generally speaking, I made a note of this. Generally speaking, it's not a question and answer type of public hearing. It's basically where you listen to what they have to say, but you don't necessarily question them or have a dialogue back and forth with them. That's not the purpose of the meeting.
Other comments can be vendors, right?
They could be vendors, they could be users,
Right.
It could be anybody, really. I mean, other county board members have come and suggested things, so, I mean, it's, so just to remind you that it's not a conversation thing, it's basically a public hearing. Okay, and I just wanted to say too, let's see. I think Harold just mentioned it too, that this kind of budgeting is necessary because the state imposed levy limits on counties where they can't levy what a county necessarily really needs to operate. They can only levy up to, in most years, it's 1 to 1.5% of a county's ability to, to levy an increase. So it's not going to cover everybody's operational expenses. It's just not going to. Okay. Oh, I want to mention too about having a surplus at the end of the year. Has no effect on our budget. It doesn't have any bearing on our budget because we don't keep any surplus in reserve. Therefore, we cannot apply anything to the next year's budget. Even if we have a great surplus the year before, it means absolutely zero because it just goes to the county contingency fund. And we just budget again for what we think we're going to need to spend. And even if we got a surplus, and I wanted to say where we get that from, surpluses have been high in recent years due to, I think, three major things. One is reduced costs for placements because we didn't need to use all of the placement costs that we budgeted. So we generally have a surplus there. We have had for the last couple of years, but that doesn't mean we can't put in there zero in placements. Because if we budgeted for zero placements and we even had one, that one placement could cost us $300,000, $400,000, $500,000 a year. So you have to budget for some placements. You can't budget for zero. Also, next big category.
But I'll tell you right now, the supervisors, that surplus is gonna come up in October. It always does, every budget time. You're gonna have some supervisor that's gonna put in resolution that wants to even cut more of our budget because they say we always come up with a surplus. So I'm just telling you, just be prepared. It's gonna come up at budget time at the board. That the surplus, always comes up and you always wanna cut it even more. So budget.
Yeah, so in addition to the placement cost being low, if we have a good year, travel and training for the last couple of years, we budget a lot of money in our accounts for travel and training for our staff. We have 300 staff. They all have to go to multiple trainings during the year. They all have to visit, 60% of the staff visit families and individuals multiple times during the week. So we have to have a lot of money for travel and training. But because of COVID, our travel and training expenses were way down. Therefore we have a surplus, which if we get finally out of the COVID pandemic and get back to full utilization of going out and doing trainings again and travel to see clients, we're not going to have a surplus there. But we've had some pretty hefty surpluses in travel and training. And the last category that we've had a lot of overages in is state and federal funding, that they actually give us more funding than we actually believed we were going to get. And we only find out about it in the last quarter of the year, when we basically can't do anything with it other than to pay for things that we've already paid with during the same year with tax levy. So when we apply state and federal funding that we didn't expect to get, we apply it for the costs that we did use tax levy for, now we freed up tax levy. So at the end of the year, you'll see in the budget books that you get from the county, well, Human Services only used 16 million of its 18 million in county tax levy. True, because we used the other monies that we got from outside sources and we applied it back, therefore we freed up more tax levy. So it doesn't mean that just because you see we used 16 million of 18 million levy last year, doesn't mean that we have 2 million somehow year after year recurring that we could reduce. And that's another thing that, people see that and they go, well, you didn't need all the money that you budgeted. Well, yes, because we had extra monies that the state and the feds gave us that we didn't expect were going to be there. And they do it pretty routinely, but not enough that we can. If Jenna were here, she'd say the auditors will not let us budget that kind of revenue. They will not allow you to budget that kind of revenue. You can't just say because you got an extra $1 million from the state and the feds last year, that now you should apply it to this year's budget. That is not acceptable auditing practice to budget.
So the money comes back to Human Services, but they don't get to keep it. It goes to the general fund instead.
Right. I'm
Even though it came to, they got to share it there.
And this has been for the 15 years that I've been here. In no year, and almost every year that I've been here, we've had a surplus. A few $100,000 to several million. But every year on December 31st, it all goes back to the general fund. So the general fund has gone up probably over the course of 15 years by, I can't even tell you how many millions of dollars. But it's in the general fund where all of you who are county board members can use it for whatever department you want to use it for. It doesn't have to be used for human services. There's no designation whatsoever for human services.
And you don't get consideration more because your 5 million that came in here,
No.
well, anyway, it just gotta go.
Yep.
So another department got 500,000 and you got 5 million. So.
It's all the general fund. Okay. Yeah, December 31st is all the general fund account. It's nothing to do with human services after December 31st. Okay, and let's see, I only got a couple more comments. There will likely be more cuts in future years. So this is something that I want to let you know about, that because we've been doing what we've been doing. And I thought that this would come sooner, the statement I'm making would come sooner than now. But in the next couple of years, we really have to take a very firm look at what is mandated that we do and are required to do by state and federal contracts, and what we wanted to do as a county for some of our providers and some of the things that aren't mandated for us. And we have some thoughts, a few of them, which I'm not going to name for you today, but they likely will come up in future years as potential reductions. So I don't want to surprise anybody that some of the things that some of you here voted to do in past years will probably come up not, maybe not this year, but in future years, because we're gonna have to use that money as well as additional potentially staff reductions, service reductions, because there isn't anything else that we have.
See what happens is the state comes up with these mandates to the county and say, you need to follow these mandates. But they won't give us any funding to do it. So we have to come up with that money.
So what we try to do is we try to look at, you know, what is mandated, what is not mandated, what services do we need to do, what positions do we need to make sure that we move on to, and then we kind of do a prioritization of where we think those rise, and then basically make some decisions internally about, like this year, you know, we picked some things that we're going to talk to you about, and obviously at the end of it, you may disagree with us totally, and you may say, we want to put that back in the budget, send that to the county exec, and that's your choice to do that. We're fine with that. It's just that if that stays in the budget, then we're gonna have to look at some other stuff to replace it with, you know, to make an additional cut. If you put something back, we're gonna have to find something else to remove. Okay, and then my last point is that when we go through this budget, then we will go through in the following order. We used to go through it alphabetically by division. This year, we're going to do something a little bit different. Child welfare is going to go first because that has conflict with something later on in the afternoon. So I want to make sure that she gets on first. And then we're going to go to admin second, then behavioral health, then economic support, and finally long-term support division. And that's the order that we'll go. And if you have any questions between now and then, please feel free to get a hold of me. I'm very available by phone, email. You know, please just ask me. Renee's available. Janet's going to be available. When you get the booklets, you might be confused about exactly where to find things. Please give us a call. We'll make sure, or email, and we'll make sure you get to where you need to go. Yeah.
How will we receive the booklet?
We're going to send it electronically, or
I believe we'll be delivering them.
okay, but I guess we're going to do mail, and they'll be
Yeah,
available.
or we'll drop them off.
I just want to know how to expect.
Yep, right to your doorstep.
So that's
Service.
So
That it's fine.
this is all gonna take place on the 29th, is that correct?
we don't. So we have probably 50 pages of budget, single space budget. When you go through it, there are things that repeat themselves in each of the divisions. So it seems more complicated than it really is. And in most cases, we haven't really changed much of the budget from last year to this year. So probably you're going to be focused in on maybe half dozen items. People don't really we don't have 400 questions about the budget. It's really, you'll see where we've kind of targeted. And
So basically, we'll start at 8:30 in the morning with the public hearing. And we're usually done by 12:30. I mean, we're 4 hours. I mean, unless there's something that we get some heavy, deep discussions that, you know, but I think usually by 12:30, and I'm gonna be gone past ever 1 o'clock.
there's revenues,
We've always
there's
had-
expenses. They're all
Right,
tied
but
over.
the first
You know,
meeting
they all-
has always been just a public. We never did the budget.
You know, and again, if you think you've got like lots of questions, give me a couple hours.
Yeah, we're just gonna do, instead of doing two separate hour, public hearings, let's do one public hearing. If we have to, if there's more public, as Bill and I thought, and we run over a little over an hour, is that 8:30 to 9:30? I mean, we'll make sure everybody has a chance to talk.
Can you explain how it works when someone can't attend a public hearing, but they send something in?
So, yeah, so in future years, so I think they can.
I think they can.
If people send something in writing through the mail, or they usually would come in, they can write something down and just can't, they don't have to speak. And then we also have to review that. So we talk to you about what the comment was, and then you guys can always say to us, we want you to respond to that. And maybe if you said to me, we want a response to that by noon on the 29th, we'll respond to that. You know, so we'll have a response back. In some cases, it's, you know, we want you to consider this, but not necessarily with us doing something. So if they said, we want to know what you paid for this type of service last year, we can research that in the morning and respond back. You know, that's it.
Well, one thing too, during the public hearing is we're there to listen to the people. Their concerns or whatever. We don't get into cross debates, we don't get into discussions, whatever. I mean, we don't get into like, questions, you know, with them. We're just there during public hearing to listen to what they want us to hear.
And that's important, only because I sat at one year for the airport one. And there were the viewers here, and they asked for questions, but nobody asked any questions. At the end of it, Jim came up and said, you guys can ask questions. I said, I didn't know if there's one that we could make suggestions, but you go back and forth. Oh yeah, we'll talk to you. You had something, we'll give you the information right now. We'll go back and forth. So I wasn't sure, and I wonder if people are on what like that, that they can make a comment, but there's no response. Could be, do they know that?
We'll say that.
Oh, okay.
Well,
Because at that meeting, nobody knew, and there was a lot of people wanting to say something, but they just thought, we want to make a suggestion, we want to ask about it. They didn't really. want to talk.
Larry does.
Yeah, I do think at the beginning, just kind of saying to the public what it's all about and what, you know, what you can do, what you can't do, and what we're gonna do, what we, yeah, I'll explain that all to them. Yeah.
So like he said, if there was something in writing that someone wanted an answer to, you're not gonna answer that person until the next day.
Probably.
So if a person had a question, you're really not gonna do anything until the next day or not at the engage at the time of the meeting. Right, okay,
Correct.
gotcha. Okay. So,
I mean, because that in public hearing could be, you know, out there, if we get into some kind of discussion.
and the reason I say that, I've been out trying to get people to get more involved.
Mhm.
And as I come to these meetings and I hear people complain or talk to me, why don't you come to me? And I don't know, and I don't think you can speak there. You just, you know, can't. I said, I see people speaking, so I know you can. So I'm trying to get more people involved to get out there, you know, Zoom or whatever, because they have a lot of stuff they're talking about. They're not bringing it. You come and see me, and nobody here. I'm like, what?
It's kind of like the same as the public comment part during the county board meeting.
That's it.
I mean, they're gonna speak, but you're not going to get across the page with them and answer the question right there. I mean, that's, yeah, but that's what we're talking about. Any other question for Bill?
Maybe a question for you, Larry. I'd be willing to work with, because I spend a lot of time looking at budgets and spend some time with people who haven't done this before, but I'm afraid that that's not much good qualify as a walking forum, will
Have a good day.
Yeah.
You like it?
Yeah. I would,
Not for hours on end.
yeah, I wouldn't get into that probably. Like, it's a good idea, it's a good idea.
We can help anybody with the budget document, you know, what's in the line, what does this mean, you know, we can certainly. We'll bring it up.
Any other questions, Bill? All right,
Change the budget.
we're getting to the budget, yeah.
I have a question.
Oh, yeah, this budget. All right, then moving on, approve the minutes of the May 2nd, 2022 Human Services Board meeting. So moved.
Second.
It's been motion seconded to approve. All in favor, say aye.
Aye.
All opposed?
Aye.
Ayes have it.
I'd like to make a comment on that.
Sure.
These are the best minutes I've ever.
All right, moving on, then we'll accept the minutes of the May 9th, 2022 ADRC committee and the February 8th, 2022 advisory committee for children voluntary service meeting. Second. Motion was made and seconded to accept these. All in favor, say aye.
Aye.
All opposed?
Who was the second? I couldn't hear who the second. Karen?
Sure.
Thank you.
All right, number 5, amend the table of organization for Winnebago County Department of Human Services to blend 2 part-time administrative associate positions into 1 full-time position. Renee,
Well, I think we're gonna switch hats, and I'm gonna do it. Only because, so, 2 things, that you've gotten, and I know we didn't get them a lot ahead of time, I apologize for that.
I was gonna say, if I could, I think that's really on order, we should have. So.
I would like to explain what happened.
Okay.
what happened was I had a conversation with Mike Pollard, and it goes to Mike, and it also goes to our co-counsel, because she forms a resolution. And typically, the parent committee would approve this first, and then it would go to the Personnel and Finance Committee second, and then it goes to the county board for consideration third. The problem this month was that the P&F committee actually had a meeting before us, which only happens very rarely, a couple times a year. So when I talked with Mike Keller about this, I said, it should come to our committee first, and then we're gonna have to wait another month until the beginning of July, and then to the county board in July. And he said, no, I think that we can present this to the P&F committee first, and he was in charge of the resolution. So that's what ensued. So that happened last Thursday. And the P&F committee got this resolution and approved it. And the rationale for why they could do it ahead of us was because there was no money transfer to this. There was simply a table of organizational change, which is, I guess, in their prerogative, not as big a deal as a money transfer.
There's no more money coming out of our.
So what didn't happen is I was waiting and assuming that they would send this back to us and that we could get this out to you like Friday of last week, and that didn't happen. And so obviously you guys can do what you want to do is when this is out of order and you don't want to vote on it at all, and you want to wait till next month, that's fine. I do think that whether you deal with this today or you don't, I think because personnel and finance already approved it, it's going to be on the county board. That's what I understand. So it's either you guys can do something with it today if you want to, or you can do nothing with it. Either case, it's going to go to the county board. And it's all because it was a weird snafu of the timing of it, and I made an assumption that I was getting this back. I didn't get it back, and I didn't recognize that I didn't get it back right away. So therefore, that's why it's landing getting to you. Now, the requirement is the agenda has to be done 24 hours ahead of time. The supplemental information hasn't always gotten here 24 hours ahead of time. I don't know that this is a disqualifier, but again, you guys can decide that as you want to. But it's basically combining two present positions already on the table of organization, two half-time positions. One's occupied right now, the other half-time is in that terrible time including. And the person who's occupying one half-time is willing and wants to go a full-time position, so it's basically just combining two halves into one full-time.
I would move that we.
Wait.
I move for the approval of the amendment of the table of organization.
We haven't discussed it yet.
Well, we got to bring it to the floor for.
Yeah, so that's my motion was, I move that we put XX 062022 on the floor for discussion.
There's a second? Chris, second. All right, now we can discuss. Anybody have any
Want to
discussion?
vote on that motion? Huh? If you vote on that motion?
I have a question.
Well, now we're doing questions.
Yeah, two copies here, 1 second. The estimated fiscal impact for 2023 budget is listed as $7,450. Is that the benefits associated with the full-time position?
Yes.
So I We're gonna for that. That's right. And my other question had to do with why it was on PNF last Thursday.
Yeah.
Thank you.
That's why, because HR, put it on, because there's no money.
I was frankly, I was surprised that Mike Clark said, move ahead with P&L for us. As I said, I don't understand that, but if you're saying that that's allowed by the P&L committee, I'll be there to talk about it.
I just hope that PNF understands that's not customary, it's not past practice, nor do we intended to move
Right.
that way going forward. You know?
Right. Karen?
Okay, there was a concern that we not even look at this since it was so quickly. So that's why I made a motion that we allow it to be looked at. And then it was seconded, that part has to be voted on, at least, so that we satisfy your concern that we're looking at something we didn't get ahead of
Right,
time.
but we can still have,
And then we can,
but we can still have a discussion. though. On your motion, we can still have a discussion.
Okay.
Do you mean that you should have gotten it sooner outside of the, when you normally get all your materials? Is that the recommendation? Because this wasn't included in everything you get. Are you saying that wasn't enough time?
This was not included, this stated on here, but it doesn't state the financial implications,
Oh,
any questions we might have, it makes us look really stupid, quite frankly. So we come here and then how do we ask the question on this? Is my concern.
and wasn't the agenda item report attached in the?
I thought it was.
Oh,
The
okay.
agenda
You're
item
saying yes,
report.
you're saying yes?
It wasn't that?
But the resolution,
Okay.
it was in the mail, paper
Got
copy.
it in the mail.
Yeah, I didn't get that. I just got this, and this.
Well,
Okay, I wouldn't
we have to do.
Okay.
Could have been mine.
Yes, it was sent ahead of time. I don't know if it was just a copy thing, like somehow. got
That's
it.
just me.
Yeah,
The resolution was not sent, however, this report here was.
Yeah, I didn't get that.
okay.
Okay,
But it sounds like everyone else did get
that
that.
was, could have been my error, Linda. Thank you.
And the other report is supposed to be done ahead of time because they give you more detail about what it is.
Right.
The resolution itself was being worked on right up until the last minute, and the resolution itself doesn't really have much detail at all. Right. Just such
Oh, now, one other, couple questions, but now then this only would come to us with the vote of the P and L.
No, normally we would get it first. We would put our vote down and send it to P and F.
Okay.
But for some reason, this month was one of those odd months where P and F met before we did.
Do we know what the result was?
Yes,
Yeah.
it's 4-0.
Yeah, 4-0.
It wasn't 5-0 because one member
Was there?
was 4-0.
You'll see in the report, when I wrote this, that, you know, the dates are how it was supposed to go.
Yeah.
And we,
And I think my colleague was trying to help us out as a department to make this change faster so that the person could actually start working, doing the job a month earlier, which, you know, for us, we had to do it out for 2 months, so, you know.
I know we had questions now about this or not.
Yeah, we're still on question.
Just want to make sure. By the way I understand it, this 19,000 part-time, that's at the whole year? The first person?
yes,
And the other person would have been 13,400 for the whole year. But we didn't have anybody for 6 months now, so we
Right.
saved that much money.
that's
Right?
why, that's
So-
why there's no budget.
That's why there's no money.
But that was budgeted originally, right? So we're
Correct.
ahead.
Okay, point of order.
Yeah.
These are not questions about should we talk about it. This is not, my motion was not about moving this thing. It was just, could we put it on the table and talk about it because there were concerns that we didn't get it soon enough. That's all we should be discussing, and we're not.
So the motion was made and seconded to bring it to the table. All those in favor say aye.
Aye.
All those opposed? Right.
Now, question.
No, you can't. You can now bring it to the
How do you
table.
do
I
that?
got to get the motion.
There you go.
Okay, Chris, go ahead.
I move for the equivalent of the amendment to the rule of organization.
For a second? Second. All right. Motion was made second. Any questions on that? Discussion on that?
Well, I have one more question.
Go ahead. Go ahead.
I'm just reading over the resolution. And it notes that the fiscal impact that ongoing costs will be approximately $1,914 per year and higher. Which is different information. And it's on the agenda item report. So where does that come from? That's a good question. Okay.
Janet prepared her financial information, so can we just defer to her? No, let's see, if we can figure this out.
I believe that my colleague put the fiscal impact statement in there. He didn't really explain it to me either, but he's kind of the guy that what's all this stuff? I don't know. I mean, actually, I don't know why it's.
My guess is because it's coming from an associate or even associate. Different salary levels, so, it's not a cost this year because the position was open, but moving forward, it'll cost a little more.
And this was the budget transfer.
Right, there's no budget transfer now.
For this year.
President Torre combined, Mike is saying that.
But that doesn't account for the benefits.
Yeah, I see the statement, he says ongoing wage costs, and so I wonder if, I'm presuming the 1914 is wage only, where our 7450 is wage and benefit. But we'll confirm.
Because don't you have to assume that a full-time person will take the benefits, so you have to go in there, half part-time people don't. So it's the potential for that much of an increase, but you have to come forward.
So part of this is that we don't do our own wage and benefit analysis when we ask for this to happen. We send it over to finance, and finance actually completes this part and tells us, we think we know what it is. They basically know what it's going to be. So I was trying to answer your question. That's why.
Yeah, and I guess if 36 people are looking at this on June 20th, whatever it is, then I just feel like I want to make sure that they all have the right information. I mean, I approved I think we can approve the table of organizational change, but those would be my questions to you before it gets to the board.
Sure, because it'll probably come up.
Yeah, we'll follow with Mike, yeah. We'll have them hopefully explain it at the board, if there's questions that come up. Good, good. Any other questions? Seeing none, all those in favor, say aye.
Aye.
All those opposed? Did you say yes?
Okay, I believe so.
I didn't know where the year name.
I can confirm.
Number 6, consider an action, if any, on future location of human services board meetings.
So maybe we put that on there
This is
because
me.
we gotta figure out.
I know. I know. I mean, I've gone over and over the last 3 weeks or whatever with, well, actually, with the county debt for last month or whatever, over this whole rule change or whatever. I'm saying, human services wants to comply with the rule, but you got supplies with the tools to do it. I mean, I just can't see how, I personally did, viewed a couple of human, party meetings, and their meeting room isn't very big, but through a laptop. I couldn't understand on Zoom anything that people said. So it's kind of like, you look for holders. Right.
Just is the new rule that all meetings have to be
Televised tape. Eventually you want to put them on a YouTube channel to be viewed, at a future time for everybody. But the thing is, all the places aren't equipped to have it. Human services, we don't have the equipment there to do it. Airport is one, conference center is one. I mean, they're telling me that the health department uses a thing called an owl, which is fine. But then I also was told that the owl is something that sits in the middle of the room and kind of goes around to people who are talking about it. But if Nicole is talking and I'm rustling papers, it's going to do on me and not do on her. I mean, so there's other things or whatever. But even if they want to do the owl thing, I mean, the TS department needs to supply us with those equipment. And they're saying, well, there's a few around, you just go pick them up from that department and bring them to your meeting. It's kind of like, I'm not gonna go, tote these things around in a bag, that our meetings or whatever. So.
Thank you. Well, for example, the reason we moved to here is because we heard this room was equipped. And now that we're here, it has the camera that can see the whole room, but clearly not the microphones.
Yeah, so
So, go ahead.
that's, sorry.
No.
My question is, can we ask Donna and Rachel how they're hearing things today? Via Zoom.
Not very clearly.
It's very difficult to understand what's being said.
That's what I figured it was. You know, it wasn't even so much to see stuff, it was more or less to hear things and understand what people
Yeah.
were saying. Yeah, that was the problem that I had watching the Parkview meetings by Zoom, is I could see people, but I couldn't understand what they were all saying.
It's very difficult to follow.
Somebody dialed into our phone for Zoom, would it be better if we had it like a speakerphone for the?
Does it have to have a visual part or can it just be audio?
Well, they wanted it to be able to be taped, and recorded for future. And then if you had people on Zoom, you'd be able to see that they were there, plus the people in the room. So, it's what we need to be getting to, but we don't really have the ideal situation. We thought this was gonna be better than human services because we don't have even this. setup.
Even the equipment, we have to use a laptop. I mean,
This isn't necessarily better, is it? Or is it?
Well, I think it is for them because they can see the whole room.
they can't hear it, but
But they can't hear us. But if we move back to human services, we won't have the camera either. So now you have no visual and hardly any audio. We can do it. You have to decide, decide.
I think the owl works better for the phone in. Better equipped for that is my understanding, because we've used that in the past at my city council meetings for people who want to call in, presenters who want to call in and present virtually.
does it record the meetings too?
That I don't know. But it's still, you still need a computer
Right.
Zoom connection. So, I want to thank you for finding a place, and I reached out personally to Larry, and had a few conversations, via email with Bill about this, because it occurred to me that if all meetings are entirely Zoom, that then we have people who may want to attend a public meeting that can't because they don't have adequate internet access or an adequate phone plan or a phone or, I mean, these things are real issues for some people and real issues in rural parts of the county. And so then we have a meeting that's not accessible either. And so we're sort of struggling through this right now. I am on the IS committee. And the decision is to move ahead. In my opinion, without knowing what it's really going to look like and how it's going to work, and or a plan for this time in between. And so that's really frustrating for a lot of folks. So thank you for your work in making this happen today. I'm open to whatever the committee chooses to do.
I think at this point, I think personally, at this point, it's up to the county board of supervisors to push this, either the IS or whatever, to get the equipment to do this. I don't know what we can do. To me, I feel like it's a rule that was made that says, okay, every county board supervisor has to use a tablet. But we're not gonna give you the tablet to use. If you're not gonna give us the tools to accomplish what the rule wants us to do, I don't know what else to do. I kept telling you that too, the county executive, we just can't comply until you guys supply us with the equipment to do it. It's just. I mean, I wish the board would have, whoever came up with the rule or whatever change would have thought about that before you approved it, to at least give us the tools to comply with it. Yeah.
We originally went out of order, and didn't know what the order should have been, but because they should have financially figured out how to do this, but on the flip side, I've been to the health board with the yellow, and that went all smooth. I came to the airport here, and that one went all smooth, but there was somebody here, I asked for whatever to help me get set it up. The same thing too, when I went to the health board, they did, somebody was there helping you to do it, wasn't waiting on you guys to do it. And then also the highway department. We had that all set up before we got there, and we only had 5 people, and that went real smooth. It was on the laptop too, so. The only thing I would think, I gotta do this because everyone wants transparency. That's how this all got started, which is okay. We want to get more people to view in. We want to get more people to listen to it. You're going to complain, you better find out what's going on and be involved. That's right. But the next thing would be to do is that the IT should be kind of helping us or setting it up before we get here. Because like I said, I was in here for 3 different meetings. It was all real good, but there was an IT person hanging out, you know.
Yeah,
And right now you're on your own. So I think wherever we do it,
Yeah.
the IT, I mean, because they're gonna end up having to be responsible to help us out to do it. But they should come in and make sure we're all ready. So when they're there, we don't, have no delay or confusion. It should be not frustrating, it should be informative. That's what it's supposed to be. And because of all this going on, I think it comes across a little more on the negative side, because we gotta do it. Those guys made us do it. We gotta do the change. The idea was good.
I knew it was good, but you got,
We're trying to find tools. We're trying to get more, we need the tools. So, and we do have some here because I've been in 4 or 5 meetings and they have them.
And that's what they're telling me, and I don't have a problem with that, but they're telling me, but you gotta go get Owl and bring it to your meeting. Kind of like, why isn't I asked Department Supply, and I mean, I heard that they're not real expensive. I know it's only 6, yeah. They're saying find out where these 6 are and go get it and bring it to your meeting. I don't know how to set it up, but bring it to my meeting.
Or just change the meetings like you said. There's 6 of them, and 6 little places where meetings will be until we can figure out.
I don't even know where 6 places are, yeah.
The highway department, which I didn't expect. I mean, they had it all set up to go. The health department was in that human service. I mean, so they worked when I was in those meetings.
So I guess my question to you guys is, where do you want to go from here? What do you want to do?
I think this is fine, and I was in Arkansas last week, and I had attended by Zoom. And as long as the people, which is why I'm speaking up now, I'm not angry. Can be, but as long as we speak up, I think Donna can hear, and as
I can hear now when you just did that.
Yeah.
so maybe even turning and facing that. But I would think that there's going to be a microphone pickup, because I didn't have an issue except with the older lady. She just went.
I think this place will work, we just have to have, like Rob said, we gotta have the people here to help us with the equipment.
We did test it on Friday. I came over and tested it on Friday with one of the gentlemen that were here. It's very, very helpful and it worked.
And it worked even Andrew.
So I'm not sure.
Do you know though, Pam, are there other microphone pickups? Because even if this, we can get the screen to work, if the audio is really what.
I think it's I think it's coming from my computer. It's supposed to be coming from this unit right up there.
The microphone
The
as well.
microphone, correct. There's a microphone and there's a speaker. There's 2 different units. The speaker was coming from up there as well. And there are speakers in the ceiling. We couldn't get those to work, but I could stand on the other side of the room and hear perfectly clearly. So something malfunctioned today, and I apologize for that. I don't know what it was, and they weren't quite sure, so I'm not sure. I think if it were all working like it did Friday, I thought we'd be
I
fine.
think humor, I mean, it just happens that they're at a conference on state, otherwise they would make it.
Right. And I think they're gonna write up some directions maybe as well, so.
So I guess my question is everybody comfortable with having meetings here?
Do you foresee them staying here in this
So
position?
that's one of the things about how we used to do our meetings is we do 1 month in Oshkosh, 1 month in Neenah, and rotate back and forth because we have numbers up there, we have public up there. So if we're staying with this temporarily until we get outfitted with something in human services, we would be here every month for our meeting.
I can, I mean,
Can
we
we check
don't-
with the airport, make sure they're open on these days?
Yeah, I will, Kim, we'll work out with her, or whatever. Yeah, until we can find a place in Neenah that's equipped like that, or we get the equipment. I mean, yeah, this is, we're gonna have to do it here.
We reserved here through August, thinking that come September, maybe wishful thinking,
Right.
come September, both of our buildings will be equipped by then.
Okay,
We'll
yeah,
be posted.
right, because Renee emailed me and she said she found this for a meeting, so then right away, I got on horn with Kim and I says, can we get it for a public hearing too? I mean, so.
Oh, you did, you've done that too.
Oh, yeah, so it's all said, yeah, the room's open all day long on the 29th. She said, so I reserved this for our public, you know, at our budget meeting for the 29th.
And I'll reserve an IT person for the 29th.
Okay, good.
Yeah, yeah, at least just to get.
To get
going.
started.
Yeah.
It worked smooth on Friday, I don't know.
So temporarily, is this so okay with people then?
I'm okay with it if you wanted to look into a place that might be put in the northern part of the county. I could check the public libraries.
I mean, that would be bad. I mean, if it's equipped and we could do it from the, you know, Neenah Public Library or whatever, I don't have a problem doing that.
Typically, we don't have a July meeting unless it's a special one for some reason. And the next one will be August
August.
after our
Yeah,
public hearing. And,
that'd be great. I mean, you can check with them and see if they're equipped and audio and video meeting.
would be the first Monday of August at 3 o'clock.
Did you say you have this reserved for the office meeting?
We do now.
We do now, but we can,
Oh,
it doesn't matter, but if you, yeah, but if, whatever, let us know whenever you find out in the Neenah Library.
I'll do that.
Oh, good.
And we only put action.
Yeah. I think we're all in consensus. All right, inpatient and institutional placement stats.
Okay,
So,
so basically our same sheets, everybody got those in the back of both. Actually, very good, month, last month, April, is our last recording. We still have no one at Lincoln Hills and Calvert Lake. That is the juvenile prison, in Wisconsin. We haven't had anybody there for several years. Very happy for that because the price tag now is over $1,000 a day. So that's great. The reason we don't have kids there is because we have a number of other alternatives that we want monthly, and we're working, continue to work. Second line of page 2, bottom of page 2 graph is,
That one was page 2?
I mean, bottom page 1.
the second, bottom page one.
Bottom page 1. Bottom page 1 is our residential care centers, and our 1 is Missy. Missy is not the name of the person, is our fictitious name, but the current representative. She's
And she's doing well. She's doing really well. She was one of the cases that we reviewed last month. And the staff there were able to connect with us. So really good.
And Annette has another. Annette, can you tell us how Missy's doing and what the plan is? No?
Sure, I can try. I think, I don't know exactly what Chris said about her. So they're working right now on, with long-term support folks, transitioning her, getting her ready for when she turns 18, which is coming up in the near future. And so they have been putting together plans for bringing her back to Wisconsin, that she'll get her services. It's her choice. That's what she wants to do, is she wants to come back to Wisconsin. So we're putting together plans for her to be back here and working with our long-term support team to do that, because then they provide services to her once she turns 18 through the managed care organization.
Okay.
Yeah, and then I just said, the report from where she is placed was really positive, that she's thriving, so. Who knows how much to say.
Yes, she is. She is thriving and she's doing very well in that setting.
Good.
So when children age out at 18, some of them can switch over to our long-term care division. So Beth's division is going to be working with her post 18. So we're happy to do that. Okay, so page 2, top of page 2 graph is our adult inpatient admissions line. And we went down from March, which again, it goes up and down, depends on the number of people who are uninsured, who have a mental health crisis and end up in an inpatient hospital. So our budget line is down again, which is great. Bottom of page 2 is our kids admissions, and they are also down for behavioral health inpatient. So looking good there, no problems. And last page, page 3, top of page 3 is juvenile detentions, and we're just about the same as the month before. Again, I'm not worried about the costs there. Those are for short-term placements in Fond du Lac. It's a jail type facility. Usually the kids aren't there that many days. And then the last line is foster care. And again, almost the same as the month before. And that just represents numbers of children that we have in our foster care system from month to month.
And if we have any issues with foster care that you're aware of, I would assume that we have to move aware.
Yes.
Complaints or children had to be moved or anything like that, no? Okay.
Is replaced where they need to be placed. So that's kind of an unremarkable report.
That's good. That's good. Where are we at with our shelter care?
Okay, our shelter
With
care
that facility out in Harrison.
Okay, so our shelter care facility is, we're currently renting it from Lutheran Social Services. We have it better than 3/4 of the way staffed with staff that we are licensed now. So it's going to be our shelter care, Winnebago County Shelter Care. We're in the process of working toward an eventual sale of the property to Winnebago County, but we're not yet ready to bring that to you officially. But we're about 75–80% of the way, I think, in that, right? To having it staffed, the shelter care.
75%, yep.
Yep. And as soon as we get to close to 100%, we can actually then bring the children back from Outagamie County and other counties where they're placed and bring it back to our shelter. But right now, they're still in the other counties, and the staff that are there are still in the process of learning the ropes. So we're hoping maybe by the end of the month we'll have the complete staff, but we are having difficulty recruiting people, just like everybody else is. Recruiting in the community to find people who want to work on residential settings with kids. So, but we're getting closer. I hope by this report next month, or by August for sure. I'm hoping that we're actually having the kids be back from
Okay. Oh, yeah.
Bill.
Yep.
On the second page, secure detention with no budget line.
It's in the budget line. Yes, and the reason for that, Harold, is because we couldn't figure out and make sense of the mathematics that went into it, because it was always showing that we were over budget when we weren't over budget. So for the time being, we're just leaving it right on.
Okay.
But we still got 3 beds, right? Yeah, we've got 2 detention, 3 beds?
We have 3 beds.
Yes, we still have 3 beds.
Okay, now I have another question. On shelter care situation, my understanding that was a losing in social services are involved, they said you couldn't afford to run it or something.
Right, they couldn't find staff, they couldn't run it correctly, so we needed to take it over.
Okay. And so then we want to take it over in order to provide the service.
Right.
Okay, correct. Now I get to scary. Has there been any discussion in a worst case scenario situation where we run into 2 or 3 other agencies ending up in the same situation? And how we're going to handle it?
Well, so you're talking about other services where we're
anything.
We're buying residential and they don't have staff.
That was the worst case situation.
Worst case, I think we come up with a scenario where might want to ask you to buy a residential, small residential group home or setting and run it ourselves. That would be worst case, but I don't see that right now on the horizon. Women's social services was a kind of special problem that was a few years in the making.
But, and I realize it depends on the particular situation, but the point is, maybe, they go between a rock and a hard place. They say, well, we can't run the service, either you guys take it over, or we don't, the county doesn't provide the service.
Well, the second part cannot be true. That we will, if they can't provide it, we then have to move it to some other level of service, and usually it's going to be more expensive and maybe possibly in states away. We still have to provide the service. It's not the choice of they can't provide it, so we're not going to provide it ourselves. It's basically you will provide it someplace and you will pay for it. So what we're trying to do is to try to provide it close to home and at the same price as LSS. That's our goal. Try to do this close to where Wisconsin is to run it through LSS.
You know, based on how you're in the news and my reading, a lot of small businesses, they can't get the, you know, employees, so just might snowball, and I guess, you know, we're gonna have to try to come up with some kind of answer, I suppose. Either hire services from another county, probably, I guess, or, I don't know what else.
We're ship them up, we're ship them on state, and they, unfortunately,
Don't wanna do that.
for Missy's costs are probably 25 to 50% higher than if there was a comparable place in state, would have been, you know, 25 to 50% less cost. But there was no one, so we had to go to Massachusetts. Because we can't just shut down. Like a business, if they can't make it work, they shut down their business. Human services can't shut down human services. We are obligated to the state and feds to run it. If we totally shut down and said we can't run human services, I guess the state could take us over, and then everybody would have to be served with a different county, potentially, or in some other part of the state. So, yeah.
Yeah, obviously, we wouldn't be the only county in Wisconsin. It really is bad to stay with it. Because the point is, the county can't take over a lot of business.
So what we're seeing is providers telling us they need to increase the amount that they're paying staff and provide better benefits, therefore that's going to be passed on to us in future years, which we get that. Because we say that's okay.
Any other? Then, financials, Jan, gonna tell us that?
I'm going to pinch it for Janet again. Okay, first of all, it's the sheet that she's told you about earlier. This one, which is the admin favorable, unfavorable, or the category favorable, unfavorable, and then the graphs. And what I will tell you is that they're not substantially different than last month, and that I want to also, I guess, give this warning that we only have 4 months of actual expenses in this forecast. So when you look at the end of the year and where we think we're going to be at the end of the year, this is based on 8 months of just projections of what happened last year. So this particular budget sheet is not accurate. I mean, it will not be absolutely accurate to what's going to happen in the year because there's 8 months of estimates based on last year's 8 months.
We can't guess it on the fourth.
No. Now, if we're happy, I can tell you about the first 4 months. Because the first 4 months of one, but that's all I can tell you. I can't tell you what the next 8 months will be. These graphs are basically giving you, a comparison based on a lot of estimation. So,
COVID, of course, I think they're gonna be probably non-COVID.
So, if you have questions about that specifically, I'll do my best to answer them, but honestly, they're looking pretty similar to last one. There's nothing surprising in these numbers. She just wanted to give you the draft representation.
Any questions? Go ahead.
Earlier in the meeting, about a third of the annual budget is fixed costs and operational costs.
Yeah.
And I'm looking at the back of the sheet, at the pie graph. At the bottom, the composition of projected year-end surplus.
Composition, yeah, okay.
So I'm just looking at the biggest piece of that pie, the operational savings. I guess that
Well, the operational savings includes also our provider savings as well. So operations in this context is a much more general category. It's kind of like combining two categories into operations, where I divided out operations from provider expenses, if that makes sense.
Yeah, that's helpful.
Okay.
Thank you.
Any other questions? You guys got way back here or something. You know, Granny? All right. Renee?
Okay, just a couple of things. So obviously, you all know it's budget time and annual report time. That's what we've been spending a lot of time on, and just for our members. So the budget book is much thicker, obviously, with this. Yeah, and then the annual report, dinner report, like this. And you'll get both around the same time. When we meet on the 29th, as you heard, we go through this book. Each division manager presents their division. So this is more lengthy, which is why we have a half-day meeting at least. And then this one is more just like a recap. Some of the information is duplicative, but I want to say we work hard not to duplicate things because that doesn't really make sense. So we've been working on that because it's budget time. So you'll be getting both of those.
Janet told me that the budget books should come out 10 to 14 days prior to our budget meeting. She's not quite sure the exact date, but she said it's probably going to be closer to 10 days than 14 days. And it's because it's continuing to make adjustments and everything that goes into that. So she kind of waits as long as she can to, before you get it. So you're going to get about 10 days notice on the budget stuff.
Because we want this to be as accurate and as up to date as it possibly can, which is why it's on your end, you might be like, grab this a little sooner. And then part of why we deliver it to you instead of putting it in the mail, because that takes some time as well. So it's not because we're just sitting on it. As soon as it's printed and ready for you, we give it to you. The other thing, just as a reminder, we've continued to tell you about, we've had new programs, new positions, and we've moved staff, Veterans Department over by us. We shifted people over to Oregon. So we've had lots of movement and settling of people in places. And then the last thing, speaking of June 29th, is if you haven't given Pam your head count, meaning you plan to attend in person, and if you know that already today, please let us know, because we do order lunch. The last 2 years, we were all online, but now we're going to be in person, so we're going to order lunch, so we want to make sure we have lunch for you.
Okay. Any questions for Renee?
That's on the 29th.
Wednesday, 20. Okay, Bill.
I've said so much today that unless you guys have questions for me, I'm gonna not give a specific.
Can I ask what? Let me have the tech meetings again.
Which one?
Tech meetings.
Oh, don't ask me about that. We're not doing it.
Still let us know. Apparently I said about every other week.
Oh, okay. I'm trying to help you out. Yeah, go ahead.
I know this.
No, you go right ahead.
But I want to check to make sure, okay. One is, I know we had that 10 $0.3 million we got for the different shovel ready events, and I think we're in charge of it, or take care of it,
No, well,
or something.
so inaccurate. So
Okay.
there was a grant that was written by Winnebago County through the Public Health Department from the Neighborhood Investment Fund for the continuation of homelessness service, shovel-ready projects. Our piece in the human services has to do with homelessness prevention, which is going to be a service that's kind of like what we do now with the aging and disability resource center. It's going to be a place where people can call or come into, and if they're struggling with the possibility of becoming homeless, our staff are going to work with them on a plan to try to prevent that. So that's our piece. That's the only piece that we do. We are not going to be monitoring all of those cases, or the rest of it is not us. Obviously, public health wrote the grant. They're going to have something to do with the oversight, and the county executive also said to me that we need to hire an outside person. So it's not us.
Everybody asks how we're doing with it.
I know for sure the money has not come in yet, because until the money comes in, we can't actually start our business. So the money hasn't come in. That's all.
So, the last question I had was, I received a letter from one of our employees that are coming, and with the shootings in different places and issues, they're concerned with a long letter. I'm not saying the name of the person. What are we doing to make our employees safe? Because a lot of times human services, anybody can come in there. I do security in other places, so I was kind of curious that you brought that up, and I didn't want them to think we just were taking. But what are we doing? Are we doing anything to make places safer for our employees?
We do have to shoot.
So this question has come up over the last 10 years, probably a handful of times. And so we looked at things like, could we have a welcome center like there's at the courthouse, where we actually have sheriffs and metal detectors. That requires sheriff's department officers, that requires a metal detection area, that requires something totally different. That was ruled out, that we're not going to do that in human services. We looked at improving the glass situation, having bulletproof glass at all the reception stations. That was reviewed. That was also determined that we're not going to do that as a company. What we do offer is very frequent trainings for our staff on personal safety, on scenarios related to that. So there's a lot of training that people get. There's backup phone systems that we use in case somebody feels that they're being threatened or could be threatened, that we can let the other staff know in the department quickly, so that they can then use their training and decide to get out or shelter in place. That's what we offer. There's a lot of training throughout the year, but pretty much in terms of what we're going to change in terms of the building, we have secure doors off of the. So if you walk in the building, you can get access to the stairways, you can get access to the elevators and bathrooms, but you can't get access into the interiors of our building without a pass, without an electronic pass. So is it 100%, safe? No, I wouldn't assure anybody that's 100% safe, but it's basically what we have. And that could a shooter come in, and could some people get hurt? Yes, but if the county wants to do something different in terms of building safety, that's kind of a facilities question.
The person made a couple comments that the sheriff department had often to do certain things to training, self-defense or whatever, and it was combined. That's why I was kind of surprised when you said
We have
that.
several going on right now.
Okay, so that was something I heard in that.
We do so.
So I want to make sure.
So the one thing I will tell you that is concerning is when you do a role play that involves, people actively pretending to be a shooter and having officers in the building. We're very concerned about trauma, that could activate some staff's trauma. And so if you have a balance of it, you want to provide an active shooter training versus are you going to traumatize people who actually have that happen and cause some emotional stress? So you kind of balance it. Some people want that, some people don't want that. So we decided that we aren't going to go as far as an active shooter role play, but we'll do videos, we'll do self-defense training, We'll do all kinds of other things in terms of training. We'll actually encourage people if they want to get some training outside. Let's find out what that is and we'll see if we can accomplish that as well. But we just don't want to do a pretend event because we think that that's going to traumatize some staff to do that.
So Ralph, I'm sure you especially be receiving the letter, I don't know what your plans are for response, but I get why you want to check into that. So, given that, like Bill said, all of our staff in terms of where they work are behind secured doors, locked areas, so to speak. So if there was some other recommendation, given that they're already in a secure area, how can bullets, protrude the glass, could somebody step the door in, all of those things. But perhaps what the specific recommendation is, if you're gonna respond then.
I just, a lot of letter made statements about this, that I'm just concerned that knew I did security and asked if I had any ideas or anything, or I mentioned it, as I didn't want to not mention it.
Right.
I do a lot of security in Appleton, and their library the last year has changed into that they have a system, they have a security person there all the time. But they have a button at the front and they have the button back into the building that if anything comes in the neighborhood near there, they hit the button, the whole place is locked up, nobody can get in, the police department are there in 2 minutes. So, but they put the system in because they had a lot of employees, the same thing, like, what could happen, we're in here, there's a lot of people coming out, but they were worried about it. And I don't know what the expense or anything else, but they did that. And they used it 3 or 4 times when people were close by doing something like the transit center or something like that. Locked down, nobody could get in, they're sitting outside the windows. So again, I'm just concerned about that because, I know you said you haven't heard of one, but it seemed like the last couple of years, more people have under their breath or talking about it or saying, geez, what about us? What about us? I think it's going to come back around. Like seeing schools are going to come back to security. There's going to be a lot of changes going around this. So I just want to bring it up so that you know that I wasn't just, and it's good because then we know that we do. Thank you.
Any modifications to the building, I've been told over the years, if you modify the building at all, then it becomes a facilities department. Yeah. So that we can do training with staff. When it comes to changing anything about the building, we have to get facilities involved and they have.
We have various kinds of bulletproof glass, you've got interior doors that lock, and they're impervious to military grade weapons, that's correct?
No.
And your self-defense that you train people is how to fight against military grade weapons?
No.
That's what I thought.
No, I want to do that. No.
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 Is the staff armed?
We cannot ask that.
For you, it's not provisional.
No.
I didn't think it was.
No, yeah, no, we don't.
Just at the courthouse.
Yeah, I don't know what's going on in the buildings. I don't know anything about what people do. And whether that's a staff person or a client. No idea.
I didn't see the signs. So
The active shooter training, I would call it the Alice training, is done by our sheriff's department. We've had two sessions so far this year in the spring. And I think sheriff's department is also offering self-defense training. I think we've offered 5 or 6 so far this year. But again, Karen, to your point, if you participate in any kind of an active shooter training, it's not how to fight off someone with a gun. It's more how you protect yourself.
Sure.
Yeah. Not how to get a gun away from someone or anything like that.
that's really
More input, Ralph, anything else? Bill?
No.
Karen?
Only that I had a former employee who's retired who asked about the facility that's on county-wide by Coughlin Center. And I said, I've toured it before it was completely finished and they've done lockdowns when you get the whole grand opening. I'll talk to you afterwards in case you'd like to invite him to, personally.
Yeah.
That's it.
Chris?
Just what you also asked about the housing piece, because I'm hearing more and more people talk about that space and no services for people. So if you can keep us posted on what's going on, I appreciate that. Nothing for me.
No, not me either.
I was trying to get in there. Yeah, what you thought. Go ahead, Annie.
No, I'm good.
Rachel?
Nothing.
All right, Donna's gone, I think, huh?
And she did. I'm not sure what happened.
The only thing I have is, we do have a special event coming up on the 25th of June. Can you tell us a little bit about that?
I certainly can, from 10 o'clock until noon, at JNR Auto, which is on the 500 blocks of Main Street here in Oshkosh, just half mile from the farmer's market. There is going to be this fantastic chef making food. It's going to be a wheelchair wash. And it's a free event for anyone who has any type of adaptive device. They can register ahead of time, or they can just come on in and we completely wash their chairs and provide some compliments. Well, I'm having some compliments. Hopefully, there will be food compliments of Larry. Frankie Joe Moscato, if any of you have ever heard of her, she's kind of a local celebrity singer. She's going to be performing there. Bunch of door prizes. You could 10 to noon, 10 to noon. There's usually people ready to have their device.
Before they had that. I already in a parking lot was full up.
But we found that it really slows down afternoon, so people are still there, if you need it to be done, that's fine, but when we just kept it open till 1 or 2, there's really not much going on. So I think it'll be much more crowded, because there's a lot of people registered already, but we have a lot of volunteers, so.
So if anybody has that day free or whatever, that 2 hours free, whatever, come on down, we need all the help we can get.
And even if you don't want to actually wash a chair, we still need someone to help maneuver the chairs from one
Chairs, yeah.
position to
I mean,
the
there's all
other.
kinds of different jobs. Yeah.
Yeah, there's a lot of different.
It's not racist.
No, it's cleaning.
Or just check.
It's really, it's a fun, it's a fun day, so it's worthwhile to get it.
So, anything else? Seeing none, I say motion to adjourn.
So moved.
Second. Discussion, all in favor, say aye. All opposed? We're adjourned till 29.
All right, see you here on the 29th. Same place.
If anyone wants to apply for that event, please let me know.
We
Sorry.
You're talking, I can't.
John Till.
Yeah.
John Till.